Can you hear me now?
Yes, Joao, perfectly. Thank you.
Thank you very much. Muy buenas tardes a todos. Muchas gracias por la invitación. I will now move to English. I sincerely apologize I cannot be with you today as it was the plan. I really regret it, but as Paulo said, particularly for public health reasons, I couldn't make it today. But of course, it's a great opportunity, and we couldn't waste this opportunity to be with you and share some of our views in terms of quality of care and patient safety in the WHO European region. As Paulo already pointed out, we are in charge of quality of care and patient safety for the WHO European region. We are sitting in Athens, in Greece, for an office which is unique. We are actually the only WHO region globally that has a specifically dedicated office for quality of care and patient safety. So this shows really the, let's say, the priority that our regional director, Dr. Hans Klug, really conveys and attributes to these areas of work. I have some slides I would like to share with you. Let me see if I can share my screen.
Compartir la pantalla.
And see if I believe you can see the full screen, the slides. So I already said a few things about the office. And I think that this topic of quality of care and patient safety is very much within the scope of your discussions during these days, and particularly today, especially when we look into opportunities to innovate in terms of healthcare and care at home and in other contexts, brings a lot of challenges. And many of these challenges, they are actually tremendously related with quality of care and patient safety. And they are in addition to some of the challenges that we already see and are facing in the context of our health system overall, from prevention to long-term care. And of course, WHO also pays a lot of attention to medication safety. We dedicated recently, a couple of years ago, one of the patient safety days, the World Patient Safety Days, actually to the importance of medication, and that's really very important. So I think that your topic of discussion today really makes a lot of sense, and I think that what I'm going to say during this conversation really could resonate with the things that you are actually doing there. So in a nutshell, I would like to say that these challenges that we are facing today in the context of our health systems, some people like to call it permacrisis. It's a health systems that you think across, for example, the WHO European region with more than 50 countries, but where we have situations where we never had before, like war in the center of Europe, climate change related health challenges, and so many things that it's like our health system has to be dealing with the usual challenges, but at the same time dealing with crises which are basically simultaneous. Only in the WHO region we have 7 great emergencies. Imagine, this was not the case before. WHO uses a system to classify emergencies according to certain levels, and we really have challenges here. And some like to say that we are living through a permacrisis, which is composed by 3 pillars. One is a crisis of value. It means that we are, the more we are investing a lot in health and healthcare, but sometimes we don't have let's say, the expected results on the other side. So some data shows and some studies show that we invest more, and we never had, for example, as many health professionals as we have today, but that is not, we're still having a crisis of workforce in many of our health systems. And therefore, the added value for more money that we invest in the system is really being challenged. And that's something that also, I think, expands and touches upon many of the areas that you are discussing here today. There's also a crisis of evidence. We are investing a lot on things that sometimes we are not entirely sure they are implementing the guidelines properly, that they are leading us to the outcomes that we would like. And last but not least, maybe the most important of all, is this crisis of, some people say, purpose, which is really that we are having huge challenges in terms of attracting and retaining health professionals, particularly the young people. Therefore, when we talk about quality of care and patient safety, we need to take this into account, and we also need to take into account when we are looking into, let's say, areas of innovation in the context of their health systems, like the ones that your project is really trying to address. Let me get the next slide. So really a series of challenges that we have discussed, and probably one of the things, although very simplistic, we could say is that we cannot continue business as usual, because the challenges we have, they require probably more innovation, social innovation around the way we are delivering healthcare. And I guess that your project is one of those that can really contribute to that. Because let's be very frank and very clear, there is no UHC without quality. And normally it's poor quality for the poor. Quality is recognized and acknowledged in the context of the Sustainable Development Goals, which of course we are failing in general in Europe. People can say it's the pandemic, it's the crisis, it's climate change, it's all of that, but the reality is that we are not moving at enough pace to achieve SDGs related with health, particularly 3.8, which is about UHC. And as I said before, we believe that there is no UHC without quality, and therefore we're making an effort, and the vision of our office is really to try and put quality a bit more at the center. So moving into what we consider health quality health systems, high quality health systems, but that really look at the system in a, let's say, holistic way, from prevention to long-term care, and considers all the actors and the different stakeholders and the different contexts where healthcare is provided. And going beyond this reductionist approach that many times we only think about certain parts of the system in a reductionist way, that many often we are, let's say, brought to the situation where we discuss more hospitals and finances, which are of course very important, but I would like us to all think about a definition of quality of care and thinking about health systems as something where quality, it's not having a quality office in an hospital or in an organization. Having checklists is about looking and reflecting on the system overall and really having quality at the center. I said it before. I mean, this slide is, I love this slide because it shows that in many countries globally, the poor outcomes are related, imagine, more than with poor quality than access to the system. And this analysis you see here, which was part of one of the papers that Margaret Crook published when she was with the Lancet Commission on Quality of Care. And you really see that, for example, for cardiovascular diseases, most of the mortality is due to poor quality, is the first line on the top, if you see it here. Very interesting that it's more a question of quality than access, which is particularly interesting. And we are looking into ways also having more data for the European region member states. We don't have much. This study is more from low and middle income countries, but in a nutshell, it really shows how little attention probably we've been paying for quality. It's like quality is something nice to have, more in addition, where we believe that quality needs to be at the system's transformation. And obviously we are not there. We are very far from being satisfactory. It's really puzzling that the WHO European region is actually lagging behind compared to other regions in terms of, let's say, patient safety and quality of care activities. I'm not going to go into detail in this slide, but just to give you a general overview about the situation globally and also in our region. In this slide, you see you have some data about harm to patients. You see some data about harm that could be avoided and attributable to diagnostic errors, but there's also errors, of course, related with medication, and that is maybe accounting for 20%. So there's many challenges which are related with quality of care and patient safety globally, and one would expect that the WHO European region actually does better in this area, but it's not so much the case. And this is why you may ask, but why a quality of care office in Europe? Well, because there's a lot of work to be done. And this gentleman here, which is our regional director, Dr. Hans Klug, which has a vision really where quality plays a central role. We have discussed with the Greek government, and the Greek government is actually supporting WHO in terms of ensuring that we can have access to resources and to opportunities to work more around quality in the WHO European region. I can see in your slides that probably you're not seeing the same slides that I have. So let me see if I can push them forward. Yeah, okay. So let me see. This is the one on the SDGs. This is the one on the high quality systems, okay, if you can see. And this is the one I really wanted to show you on with Margaret Krug's study. And this is the one with some global data, okay? And there's a slide with the Prime Minister of Greece when we signed, when we established the office here in Athens.
Joao, can you hear me?
Yes?
Joao, sorry, can you please
Perdona,
put
Joao,
that in
quizá puedes
slideshow
ponerlo en
mode?
presentación, en modo presentación.
I did.
Okay.
I'm going to try and pass one of the slides, see if it works.
Okay.
Or you can
We are not-
only see, wait a moment,
We are seeing the slide with the
just a
Dr.
second,
Cooper,
Just-
Minister of Greece.
just a
Tenemos al
second.
ministro griego.
Okay, let me see then.
Okay, now perfect.
Ahora está perfecto.
Muy bien. Thank you,
Not
sorry
now.
about that. Sorry. It's
Ahora
okay?
otra vez no.
No, it's not.
No, ahora no está bien.
It was okay
Estaba
before,
bien y ahora ya
because now
no.
we are seeing the slide and the next one.
Porque ahora
with some
vemos la
text.
diapositiva actual y la siguiente. Es
Wait a
para el
second.
modo orador.
Now?
Okay, now it's
Sí,
perfect.
ahora está
Thank you, Joao.
perfecto. Gracias, Joe.
Okay, muy bien.
Vale.
So here, as I said, the launch
tenemos
of the office in
Dentro de la
Athens
oficina, la
3
apertura de la
years
oficina
ago.
de Atenas,
Basically, it's going to be 4 years in March
para campañas en
2025.
marzo
And really a
2025,
reflection of the priority that the regional
reflexión de la
office, WHO Regional Office for Europe,
para
has attributed
por una
to,
oficina
to
regional.
quality of care.
se
And
centra en la
why we do
asistencia
this? Because we also acknowledge, we have to
que
acknowledge
y
that
tenemos que
in the
reconocer
European region, there
que en la
are
Unión
still
Europea todavía hay
circumstances where citizens and
circunstancias
patients, they
en las que
don't
los
feel
ciudadanos y los
so
pacientes
engaged with the health system. There
no
are
se
issues with
involucrados en el sistema
confidence.
sanitario,
There are
ah,
issues of trust beyond
del
access as
apoyo, de
well.
confianza.
This is a slide that of a study, People's Voice survey we did together with our colleagues from, again, Margaret Krug from the Harvard School of Public Health. And we asked the population, not the patients in hospitals or health centers, we asked the population in general, national representative samples, the levels of confidence, whether they would be able to find the care they need when they are going through difficult health circumstances in their lives and all of that. And you can see that on one hand, there's a
Porque
very
por un lado,
significant part of the population that
una
believe they
parte
cannot
importante de la población
get
que creen que
access. This is an
no
EU
pueden
country.
tener
I'm not going
acceso.
to say which country it is, but
Eso
many
de
countries,
la Unión Europea,
the
no voy a decir cuál,
circumstances might be
pero en muchos
relatively
países
similar.
la
So
situación
the
sería
confidence of
similar.
getting what you need from the system
Pues
is not
que
fantastic. And
puedan
also,
conseguir del
many
sistema,
individuals, actually the
y
majority,
muchas
almost
personas, la
2/3 of the
mayoría,
individuals,
casi
believe that
2/3
the
de las
system
personas
needs
creen que
improvement.
el
And
sistema
that's
necesita
really
mejoras.
very significant,
Y esto
I
es muy
would say.
significativo, diría yo.
This is yet another way of presenting some of the data. One of the countries where we conducted the study was actually in Greece.
Hemos realizado ese estudio en
And
Grecia.
for example, when you
Por
think
ejemplo,
about mental health care,
piensa en el
the
cuidado
population
de
believes
la mente,
that in
digamos,
most cases, the services tend to be of a quality level which is,
al
let's
nivel
say,
de calidad,
not as good as they would expect. In general, the
no se le
classification as
esa
fair or
sociedad
poor
de
is very high.
clasificación de si
And
es
when it
pobre
comes to,
o es
for
muy
example,
elevado.
service like
Por
mental health, which
ejemplo,
tend to be,
algunos
unfortunately,
servicios
those services with
de la
with
salud mental
higher levels of poor quality,
tienen
you can see
un
the
nivel
results here, which are not
superior.
extremely good. So, and in general, we have data from many, many countries, not always with this study. This study has been done only in a handful of countries in the WHO European region, but just to illustrate that probably we need to take more into account what our citizens think about really the health system. So this is why WHO has established a bit this office, because of the challenges we are facing and the response that we feel that countries are giving to its citizens, and that probably they feel that can be better and can be improved. And of course, when we establish this office, we have basically our vision is to work with countries directly. We have a lot of technical support to countries. Some need more than others, of course. We're very much focused on innovation, on policy analysis, and also on network building, which is very much what we are doing here today. This is all as part of the implementation of the WHO public health policy, which is the so-called European Program of Work, which, by the way, finishes this year, and we will start eventually a new one in 2025. So the vision for what we do is really to serve countries, provide direct support, and we work directly with 22 countries at the moment, 22, 23, but also harnessing the power of innovation. We have several projects which are of innovation, which I would say sometimes related with AI and digital. And we have, for example, developed the first tool to evaluate quality of telehealth services. It's a first. We were also the first to develop standards for evaluate the quality of mental health services for children and adolescents. And we also have a project that really involves young people in the definition of policies around quality of mental health. So a lot of direct support to countries, but also I would say 70% to countries and 30% really on the innovation and looking into cutting edge. Because, as I said before, we have a long way to go. Next week, we are launching the first ever progress report on quality of care in Europe, in the European region. And as you can see, we base this on existing data and data sets from WHO, OECD, and others. And we also collected data from all countries through a survey that we conduct normally every other year. And in reality, I'm gonna share with you in a snapshot a few of the findings, and which are a bit striking. Basically, we found that only 1 in 3 countries have a national action plan on quality of care. That again, only maybe 1/3 has an action plan on patient safety. Only 1/3 of countries have accreditation systems for whatever they're worth. Many more countries with antimicrobial resistance plans, for example, but about 20%, 2 out of 10 don't have it, which is very serious. Only 1 in 10 basically have plans in place to deal with misinformation. Misinformation is really a cancer in terms of quality of care, and it's very important that we address it heads on, and people are not doing it. And I would say that something that really worries me is that a vast number of countries, they don't have patient public representation in national healthcare governance. And when we talk about quality, sometimes patients and patient safety, patients and their families are not so much involved. So really more needs to be done. Guidelines around telehealth and quality, also very few countries, 1 out of 10 again. 1/3 of countries don't yet have electronic health records, which is again very striking. Of course, WHO region is very big. We have more than 50 countries. We have countries from EU to Central Asia. There's a huge diversity, but still very significant that a lot more needs to be done. So in a nutshell, these fact sheets, they will be available soon online and you can have a look. But I mean, overall, we really have a long way to go when it comes to quality of care and patient safety. We also collected data specifically on indicators that WHO normally collects, but also through other partners, notably the EU, OECD, and so on and so forth. We collected indicators on effectiveness and efficiency as part of the definition of quality. And there's a 4 times difference between the best and the worst country in the region. For example, for standardized preventable mortality, can you imagine 4-fold? 6 times in terms of 30-day mortality after hospital admission for acute myocardial infarction. So 6-fold difference from the best country and eventually the worst. I wouldn't like to say the worst, but just to give you an idea. In terms of patient safety related indicators, also huge differences. In terms of medical mistakes, for example, we have a 4-time difference between the best off and the worst off country. In terms of people-centered indicators, percentage of the population, the patients that indicate that their doctor involved them in the decisions made about their care. There's huge difference that we found also between many countries. And that's really, really, really striking. And the percentage varies between 60% to almost 100% in some of the good countries. But those who perform better, they are really not that many. So a lot more to be done. In terms of unmet needs, for example, around dental care, so then we identified some indicators of markers of quality of care. And in terms of equity, 16-fold differences in the European region. In terms of vaccination, also almost for influenza, almost 20 times difference between, let's say, the best and the worst country. Huge differences also in terms of the workforce, high prevalence of burnout in the workforce. We also found huge differences between the different subgroups in our region. So you can see these are groupings that sometimes we use, the Southeastern European Health Network countries, the EU15, the EU13, CIS, these are mostly the Russian-speaking countries, and you can see that normally the EU, of course, tends to perform a little bit better in terms of the 6 dimensions of quality. There are still huge differences between those, and even within the EU, if you compare EU13 and with EU15, you would see very striking differences. So let's say the second and third bar in every group, right? This one and this one. So even within the EU, one would expect, oh, the EU is more or less harmonious. It's not. Very significant difference when it comes to quality of care. We have one of the biggest problems we have is country reporting, right? Let's say the OECD has 150 or more indicators for quality. Countries at the most measure, some countries measure 50, and in many cases is outdated. And so we really need to do much better when it comes to quality. When it comes to the areas you are discussing, health at home, care at home, medication errors, these are areas where clearly we don't have enough data, and countries are not collecting as much data as we would clearly expect as well. So you can see here also huge differences between the different parts of the European region. In some cases, there are countries that don't have any indicator that looks at patient centeredness and equity, and that's really very striking for us. So we have prepared country profiles for all countries. They will be launched on the 10th and 11th of December. So if you have curiosity, then you can go to the website, at our website at the time. If you follow us on social media as well, you have access. I'm sure you'll be curious about your country profile from your own country. We're collecting for all 53 countries. It's not perfect because a lot of data is missing. We are going to collect and update already next year in 2025, but it's a baseline. It's the first time. It's really a first, and we would really like to ask also for your support and to count on you in the countries so that we can improve the quality of the data that we actually collect. Beyond that, we do a lot of work in countries. We have a very strong project in Greece, another one in Romania, another one on North Macedonia. In Greece, we are revamping totally the information system and developing a completely new tool to collect quality data from all the health facilities across Greece, particularly public ones, but also later on moving to private ones, and including a very strong component on long-term care, which I believe it links a lot with what you are doing there. In Romania, we developed a quite unique set of indicators, 25 indicators, to look on how the system performs overall in terms of quality, and this is going to be used in terms of a quality fund that has been implemented in the country and so on. North Macedonia, we developed their first patient safety plan because, unfortunately, as we have seen, we have 2/3 of countries without patient safety plans. So particularly strong work being done in Greece. Quality for All is the name of this new tool. And if you have curiosity, please let me know, because we will be collecting indicators that relate a lot with long-term care and quality healthcare at home as well, developing a national strategy as well. As I said, we've done a lot of work on mental health, quality of mental health services for children and adolescents. Recently, we implemented the first autumn school on quality of care for mental health services for children and adolescents that took place in Thessaloniki, the north of Greece, some weeks ago, and we had more than 20 countries participating. So we're really very keen to improve the quality of mental health services involving young people living with mental health conditions. And really, this is an innovation. And if you have curiosity, here in the slide, I will share the slides with you. There are some publications and some of the tools that we are actually been working. You have the standards, as I mentioned, I mentioned before. We also actually working with Paulo Souza, as he is the head of the very important WHO collaborating center that we have in Lisbon at Nova School of Public Health. And with Paulo, jointly, we developed a quite unique school on quality of care and patient safety. We already organized 2, always with more than 20 countries. All of them have been taking place in Lisbon, and they've been a huge success, I would say. And here I would like publicly, on behalf of WHO, to thank Paulo and all those involved for this quality of care and patient safety course, which involves many countries, but where the areas you are actually addressing, we have only touched upon them en passant, very superficially. So I would like to challenge you that maybe in the future, this is an area where we can work together a little bit more moving forward. So this is just a little bit of an illustration about the quality of care course. Innovation, we talked about it. I gave you some examples. These tools are available on our website, and if you want to know more about it, just drop me a line and really let me know. Above all, our focus is very much on the quality, but from a perspective of equity. So we like to talk about healthcare, which brings more value, but in the context of human rights. So value/rights, and really having in mind that we need to focus more on really the outcomes that matter to patients. And the discussions and your deliberations are very important because you're looking into a provision of healthcare, which is done many times at the place where the patients and their families prefer to be, which is at home. And this is really very humane, I would say, and really touches upon a lot on the equity aspects. So we know that normally the poor are the ones that receive the poor quality, and this is something that the most vulnerable we really need to take into account when it comes to quality. At sometimes quality has been more a fancy thing to the rich countries and those who with higher income in countries, but we really would like very much moving forward to address that. So maybe just as I finish, I would like to share with you that meanwhile, WHO has recently issued a new framework for health systems, which includes quality also at the center. It was adopted late October at the Regional Committee for Europe. It's really a framework which focuses on trust and transformation. So very much close to your topic of today as well. And I would like to suggest that you all have a look. It's available online, and it's really the framework where we're all operating and will be operating for the next 5 years, and really making sure that we take all of this into account. At the end of my presentation, as I will share the slides, I also share with you a series of information more focused on long-term care and health at home that you can have a look, but I will leave it for later because I don't think I have time to go too much in depth there today. I would like to leave you maybe with this snapshot of the framework, try to sort of give it a little bit of inspiration for you to go and check, because I think is quite a good one. And maybe just to finish with a reference to the fact that everything that we do is really focused on patients and their families. So here at the Athens office, we are very much focused as an area of innovation on the patient experience, making sure that the voices of patients and their families are strongly heard and that they are part of the process, that they are involved, that they take part of the decisions that are made around their health care and their health status. So this for us is very important. This picture and all the let's say the words you see there, they are in Greek because they reflect, and the photo is a snapshot of a very big meeting that we held here in September, which was the Athens Patient Forum, where we have patients from across Europe really very much focused on discussing how can patients' voices be more and better heard. We will be also continue to work in this area, and there will be more there for sure in the future. So maybe, Paulo, I would stop here, and if there are any questions, I'm very happy to share my slides. I think I sent them to you, so if you could share them with the organizers, feel free. Over. Thank you.
Si tenéis
Okay,
alguna pregunta,
thank you, Joao.
gracias. Muchísimas gracias, Joao.
Joao, can you hear me?
Very well.
Okay, so thank you
Muchas
very much for
gracias,
this
muchas
very
gracias por
interesting
esta
and
interesante
comprehensive
y
presentation,
amplia
and
presentación,
particularly for
exhaustiva, sobre
sharing
todo por
with us
compartir con
some of
nosotros
the
algunos
sharing with us in first hand,
compartir
let's
de
say,
primera mano, digamos,
some of the
algunos de los
results of the
resultados
report that will
del
be released
informe que vais
next
a
week.
divulgar
So
la semana que
thank you very
viene,
much.
así que publicar la semana que viene. Así que
I'm not
muchísimas
sure if we
gracias.
have
No
time
estoy
for
seguro si tenemos
questions.
tiempo para
José,
preguntas.
one
José,
question
una
if you have
pregunta,
time.
sí, una preguntita.
We have-
¿Alguien entre
Okay, we have
público?
one question,
Vale,
Joao.
tenemos una pregunta, Joao.
I will. But
Yo.
Dr. Breda knows me.
Dr.
I'm Tio.
Breda.
Hello, brother.
Hola, Joao.
How's everything?
Very
My
good.
question
Thank
is,
you.
I'm looking for.
Gracias, gracias.
My question
Mi
is,
pregunta es,
for a cost action, I'm referring to our organization.
me refiero a la
What kind of
organización, ¿qué
initiatives we
tipo de
may align
iniciativas
with WHO
se
and
pueden hacer
assist
junto
your
con la
work
OMS
and promote
que
our
asistan a tu trabajo
common
para
projects and things
promocionar
like
un poco
that?
determinados proyectos?
Yeah, thank you very much. I mean, and thank you above all for your
Gracias por
willingness
la pregunta.
to discuss with us and to collaborate with us. I
Para
believe
colaborar.
that there
Creo
are
firmemente
areas
que
like
hay algunos
patient safety,
ámbitos
which
en los
is
que la
really
seguridad
an area where we
paciente
can really collaborate and work together.
colaborar
There are
juntos,
the
estrechamente.
areas of patient experiences where we would
la
really like to
experiencia del
expand our network of
Era lo que
stakeholders
nos
and
gustaría
collaboration.
dentro de nuestra red de colaboración.
I believe that the utilization,
Creo
for example,
firmemente
and
que, por
testing and
ejemplo,
piloting of our tools, notably the
interesante
telehealth quality of care tool, which we are trying to promote to be used in countries. So we would really like to see the tools that we develop and the policies that WHO develops by request of member states, of course, can be having an impact on the ground. So in a very pragmatic way, would be to look at the tools that we have developed, to look at the data that we put together and see which are the things that potentially we can do together to move forward with the agenda and really to have an impact on the ground. I mean, I see many countries really discussing topics like health at home and how you ensure safety and quality. And this is certainly something that makes sense to discuss in this context. So in a way, quality covers all the full spectrum of healthcare from prevention to long-term care. And here, if you have ideas, and there is no quality, there is no UHC without quality. That's really the most important. And therefore, everything we do, I think we really need to bring the quality lens.
Muchísimas
Joao.
gracias, Joao.
I wish you
Le
a
deseo
fast recover,
una
and I'm looking
pronta
forward to see you
recuperación
in 2 weeks.
y esperamos poderle ver, espero poderle ver en 2
Thank you.
semanas.
Bye-bye.
Gracias, gracias, adiós.